distinction. So to start with that, I'm going to tell you a little bit more about Daisy. The Daisy Foundation was established in 1999 by members of the family of Patrick Barnes. He was 33 years old and died of complications of an autoimmune disease, ITP. Like many families we see every day go through this kind of horrific loss, the Barnes family wanted to do something positive to honor a very special man that Patrick was. So as they say, over a very liquid dinner, right after Pat's death, they came up with DAISY, an acronym for diseases attacking the immune system. As they brainstormed what the DAISY Foundation would actually do, they kept coming back to the one positive thing they held on to during Pat's 8-week illness, the extraordinary care he received and that they received from Pat's nurses. The family was very impressed by the clinical care Pat's nurses provided, but what really overwhelmed them was the compassion and kindness that his nurse brought to Pat's bedside day in and day out. The nurse's sensitivity made a great difference in the Barnes experience, and they wanted to say thank you for the nurses for the extraordinary care they provided patients and family every day. So Pat's family created the DAISY Award for Extraordinary Nurses. What started out as a thank you from their family to nurses has grown into a meaningful recognition program embraced by healthcare organizations around the world. We are very proud to partner with DAISY as we have extraordinary nurses here at the Bellevue Hospital.
And now I have the wonderful opportunity to be able to announce who our winner is. So I'm going to actually ask the winner to come up and stand to the side as I read her story. So Eva, if you would please join me.
Thank you.
Absolutely. So I want to say first that I'm so sorry that we are doing this under these circumstances of COVID, and that we aren't able to do this in the middle of the atrium with many, many hospital people and other administrators here, because we all wanted to be a part of this. But because of social distancing, we wanted to make sure we keep everyone safe. So you get to enjoy it with your family here and us today. So absolutely. So I'm honored to be able to read your story. So on October 5th, 2020, I, not me, the nominee, or the person that nominated Eva, was induced for labor with her second child. As the labor progressed, Eva entered the room to assist Laura, who was also working with Eva that day, and she was already helping her with her labor. Eva brought the most calming and peaceful presence with her. I wanted to have a natural delivery, and around the time Eva entered, I was struggling with that. I was begging to give up and was tearful, thinking I would end up with an epidural. I knew if I could stay calm, I could do it, but that was just the problem. I could not keep myself calm. Due to COVID, my mother, birth coach, could not be with me. As the labor became more intense, I became more scared, upset, and felt less in control. I knew if my mom were there, she would be helping me stay focused, which just upset me even more. It was at that time that Eva came to my side and began to coach me to help me relax and bring me back to the focus of delivering my baby. Her voice was so calming and kind. She stayed right with me. She and Laura worked like a well-oiled machine together. They kept the focus on me, and I have never felt more important in my entire life. There was a point that Eva was sitting on the floor to hold the fetal monitor in place so I could be in the most comfortable position. Eva was so gentle and thoughtful and knew exactly how to rub my back and applying pressure to my hips for relief. She provided the care above and beyond what a birth coach would, without hesitation, without even having to ask. As I started pushing to deliver, I felt myself losing all control. The labor was so fast and incredibly painful, and I could not remain focused and calm any longer. I will never in my life forget the exact moment where I was going to give up. I cried out at the top of my lungs. I had given up. And at that exact moment, amongst all the chaos that was racing through my mind, I heard the soft and calm voice call my name. I opened my eyes and was looking directly at me were the most calming blue eyes I had ever seen. It was Eva. She was right next to my face, looking directly at me. She spoke to me in the calmest tone and had me keep eye contact with her. It was her actions that brought me back on track. It was the calm in her eyes that regained my focus, and her coaching that helped me to finish labor and deliver my baby. There are certainly roles and responsibilities that a nurse must fulfill, and believe me, Eva did, but it was much more than that. Her training and education were certainly evident in her knowledge surrounding the delivery, but her compassion, her dedication, and her kindness is what helped me get through that delivery. Eva stepped up into a role that was above and beyond the requirements of her job. She proved that her passion for her job is more than could ever be printed in a job description. The compassion, care, and love she showed me, an otherwise complete stranger, will never be forgotten. I will never forget the softness of her voice, the warmth of her eyes. She truly helped at a time when I thought I could not go on. Eva, thank you for the extraordinary care that you provided to me, my baby, and my husband that day. Your kindness was more than we ever expected. Thank you for helping me take the most painful experience of my life and create it into the most joyous and happy experience. We appreciate everything you did for us that day and for treating us as if we were family. You are truly deserving of a Daisy Award and so much more. Your passion for nursing shines so bright and makes you stand out above the rest. And that was nominated by Colleen Jessberger. And that is the epitome of what this is. So congratulations and thank you for being such an extraordinary caregiver.
Well done.
And now I get to read the award. So it's the Daisy Foundation honoring nurses internationally in memory of J. Patrick Barnes. The Daisy Award for Extraordinary Nurses. This award is presented to Eva Sherry in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people. And I'm going to let Holly give this to you.
And I have a pin for you. So when Patrick was in the hospital, yes, when Patrick was in the hospital, his stepmother Bonnie noticed the great tradition that nurses have of wearing pins. So they created the Daisy Award pin for you to wear, and I hope you wear this proudly. Pin on you? Sure. Somewhere.
It's like nursing school all over
I know,
again.
but I can't. Yes, it's so sweet. There. Congratulations.
Well done.
Thank you.
All right, I'm going to
Yes.
join you, Holly.
I'll step over this.
So I'm going to tell you the story of the Healer's Touch Award. This beautiful sculpture is for you. It's called the Healer's Touch. What a perfect representation of the bond between nurses and their patients. These sculptures are handcrafted by artists in Zimbabwe, and each piece is signed by one of the many Shona artists that the Daisy Foundation supports. As you may know, the economy and politics of Zimbabwe have been in turmoil for decades, and the artists are able to support hundreds of people in their family with this work. Please take 5 minutes and go to the Daisy Foundation org website, and you'll find a video that 2 of the artists have made to show how they create these sculptures out of serpentine stone. The Daisy Foundation feels that nurses are reaching around the world and impacting the lives of these very special artists, and the artists are filled with gratitude to the nurses for this work. I'm also going to tell you about some benefits that you have as a Daisy honoree. In your gift bag is an insert highlighting the many benefits and opportunities you receive as a Daisy honoree. Some of the benefits include the opportunity to apply or renew ANCC certification at a special rate, a reduced tuition for Chamberlain University College of Nursing, and the ability to apply for the Cherokee Nursing Conference Scholarship to help you fund your attendance at a nursing conference and support your career advancement. Honorees are also eligible for the Institute for Healthcare Improvement National Patient Safety Foundation Daisy Award for Extraordinary Nurses. You can view a full list of current benefits and opportunities on the Daisy Foundation website. Congratulations.
Thank you.
Oh. I would like to present. Congratulations.
That's so exciting, so exciting. So now the next best thing are the cinnamon rolls. So yes, it would be better if they were baked here and we had the aroma, but we have the cinnamon rolls nonetheless. So there are several reasons why the Daisy Foundation asked that cinnamon rolls be served at Daisy celebrations. First, when Pat was ill and he lost his appetite, and he wasn't able to eat, one morning he asked for a bite of cinnamon roll that his dad had brought for his own breakfast, and he ended up eating the whole thing. So his dad, Mark, had mixed emotions about this, but was glad that he was finally eating something. That night, as his family was leaving, Pat asked that they bring a cinnamon roll the next day, and to be sure to bring enough for all the nurses on the unit, which, the nurses loved. Those cinnamon rolls were Pat's thank you to the nurses, and the foundation wants all nurses to share in his favorite treat as a gift of gratitude to you all today. The second reason is that nursing is a real team sport. We've never seen better teamwork than we see among all of you. So the cinnamon rolls are to celebrate your team, give you an opportunity to stop for a few minutes and share something special together. And finally, almost without exception, when a nurse receives a Daisy Award, the humble response is, I didn't do anything special, I was just doing my job. What the Daisy nurse may not realize, however, is that when nurses are just doing their jobs, they have such an important and meaningful impact on the lives of so many people, many more than just their patients. So that's why Daisy asked that cinnamon rolls be shared at every presentation, so we have them here today. Their message is this: whenever you smell a cinnamon roll, whenever you taste one, whenever you think of one, or if you're baking with a cinnamon at home, please remind yourself how special you are. Whenever you're just doing your job and not doing anything special, you're making a positive difference in a patient's and their families' lives. You're making the world a better place because you're a nurse. We in the Daisy Foundation salute you and we honor you. Please enjoy the cinnamon rolls as Pat's gift, and an everlasting thank you for being a nurse. You are truly very, very special people, all of you.
All right. So normally, if this wasn't COVID, we would have invited Colleen and family to be here today to witness this, but since we can't, I am sure Colleen would be very pleased to know that you received the award. So we'll do a shout out to Colleen and her family. Thank you for taking the time to write the nomination and sharing your part of the Daisy Award. And I guess at this point there's just one more thing we need to do. So you might want to put those down. So let's see. Need you to grab that side. And we are going to hang this banner in the unit for the next month, the next 6 months, who knows, until Holly gets tired of seeing it, in your honor. And we want everyone who walks into this unit to know that we have an extraordinary nurse from Bellevue Hospital working for us. Eva, at some point, yes, we're going to have you sign your name on here, and that is going to start the tradition of all of our honorees signing our Daisy banner so that we can see the legacy that we are starting here today at Bellevue Hospital. So would you mind walking with me over here and we'll hang in the hallway?
Sure. You need a ladder? No. I would need a ladder too.
Short one.
I'm not gonna be taller than she is.
That was our word because this was stopping. Well, no, it's something even better.
It is Christmas time, you know.
It is Christmas time. So there we go.
What an awesome first Daisy winner.
Yes.
Set the bar high.
You set the bar high.
Congratulations,
She's doing my job.
I was
So
just doing
I
my
guess
job.
the final thing we're going to do is give Eva the opportunity to say anything if you would like. And it is part of the script. I'm not just putting you on the spot. So if you want to share any feelings or emotion.
I guess I grew up in this department, so my thanks goes to all the women that have brought me here today, because I literally grew up in this department. So all my training and all of my education and everything that I've learned, I really try and put into all of my patient care that I'm very passionate about moms and babies and autonomy and labor and making sure that moms feel safe and supported during labor. So I learned everything from every bit of one of the nurses that I work with. I picked up something from everybody, so thank you so much for the opportunity.